I'm Biresh Banerjee. Welcome to DW News Asia. Glad you could join us. Women in India's Rajasthan state are demanding compensation for the deaths of their husbands while they worked as sandstone miners. Sandstone mining in this western state is a labor-intensive process that also includes breaking the rock into smaller pieces by hand tools, a process that exposes miners to fine silica dust that causes deadly silicosis. The lung disease has been responsible for the deaths of many men who worked as miners. And in a cruel twist of fate, their widows, who are demanding compensation for their deaths, are also having to work in the same mines to support their families. DW correspondent Adil Bhat reports from the village of Budhpura.
Jumabai still goes to the sandstone mine in Budhpura village every day to work. A mine that took her husband 2 decades ago. Today, she is joining a group of widows along with her daughters to carve and break sandstone. They are among thousands of women whose husbands died from silicosis, a fatal lung disease. Juma was left with 8 children to raise. She barely scrapes by. She and 3 of her daughters earn just 10 euros per day.
There were a lot of struggles after the death of my husband. At times, there was no flour at home to cook food. We used to go to sleep hungry. When my daughters grew up, I asked them to study, but they said, "Mother, how will you feed us on your own?" So they came to work with me.
Juma says she has a bad headache today, but taking time off from work is not an option.
My husband got sick while working there.
In Budhpura, unregulated and unsafe mines are thriving. They're also killing thousands. The lack of health safeguards is a concern for women working in this industry. Just next to the mining site, dozens of women are gathering to get legal advice so they can claim financial compensation from the government. The widows have been fighting to get money for years. Rana Sen Gupta is checking documents and registering women's names. He and his lawyers are preparing a list of those who lost their husbands to lung disease.
Mine owners face no financial penalty. They don't care if miners live or die. So the government needs to wake up because so many mine workers have died. And we cannot bear the loss of human life anymore.
Outside the village, a number of mine workers who have fallen ill are looking for help at this hospital. But there are few doctors and no infrastructure. Gaurav was diagnosed with silicosis 2 years ago. He complains of severe chest pain and breathlessness. The doctor examining him says his lungs are completely damaged.
Every day, we see 50 to 60 patients with respiratory problems. 50% of them are diagnosed with silicosis. This is an alarming disease. There are a number of stage 3 cases that have now turned dangerous.
Back at the mines, Juma and other women work hard without any protection. And because there are few robust regulations, their lives are at risk, just as their husbands' lives once were.
And joining me now for more context is Dr. Pekhom Basu from the Tata Institute of Social Sciences. Dr. Basu, you've looked at the issue of undercounting of silicosis deaths in Rajasthan and the impact on widows of mine workers. How many deaths are we talking about here, and why is there undercounting in the first place?
First, the reason for undercounting is because of the misdiagnosis, because silicosis is often mistaken to be tuberculosis, and the difference is that tuberculosis is a curable disease, whereas silicosis is not. Tuberculosis one can get for a number of reasons, whereas silicosis exposure is almost always only when you're working in mines or you're exposed to the silica dust. So that is one of the reasons for the undercounting. And in terms of the death, the scale is really not known simply because we have not kept an account. Because the people who are dying are primarily working in the informal sector. So even their jobs are not counted for, much less their lives.
I mean, we're talking about villages, and we're calling these villages villages of widows because the men folk who are working in these mines are dying after having worked in these mines. If one puts two and two together, one would think that this is a significant number.
Definitely, because there are about more than 3.3 lakhs mine workers at a conservative estimate, because there are 33,000 mines roughly registered in Rajasthan alone. So if you look at it, even if you're looking at a conservative estimate of 10 workers per mine, so you can understand the scale that we are talking about.
We're talking of
These are
some
direct workers.
And we're talking about in excess of 300,000 workers, if my maths is correct. I mean, just those numbers alone, even with these conservative estimates, one would imagine there should be enough of a reason to focus on something not being right in these particular areas where there are sandstone mines. Why isn't there any focus on this?
One thing you have to understand that, yes, while we do not have the exact number, but the government has been aware of this, which is why silicosis was declared to be an epidemic in the state of Rajasthan a couple of years ago. So obviously, it is it's a problem, right? Which is why they declared it as an epidemic. But then thereafter, the mechanisms that need to be there in terms of prevention, there is nothing that is being done in terms of prevention. What is happening today is only in terms of after the death has happened. So after the person has already, once you get silicosis, it is, like I said, an incurable disease. So the only thing then is to wait for death. That's it.
So why isn't anything being done in terms of taking preventative measures, or for that matter, rules? There must be rules to prevent these kinds of deaths to happen. There must be rules that require mine workers to wear protective clothing, for instance.
Yes, there are rules. There are rules and regulations. There are a number of government departments who are, responsible for implementing the rules and regulations, but they are not happening. One of the reasons is, so primarily the owners of the mines and the quarries are responsible, right? They are the ones who should be accountable for the death, because if someone is employed in your mine and then is exposed to the silica dust and therefore gets silicosis, then obviously it is your primary responsibility. And then the other system which is responsible is the health system. Again, there is a failure to diagnose the disease. Like I said, there's a misdiagnosis that takes place. So the health system fails to diagnose. And then there is an act, there's a provision in that act of the Mines Act, that if you come across any silicosis or any of the pneumoconiosis diseases, then you also have to report it to the authority. Even that reporting does not take place by the medical professionals. So as a result, so collectively, the rules are being violated.
The women who are widows as a result of losing their husbands in these in these sandstone mines, will they get any compensation?
They do. Over the years, there has been compensation for the widows. It started with an amount of 1 lakh rupees. Today, it is 5 lakhs rupees for a death. So that is the amount that the widows are entitled to. But it's not a compensation. It's a monetary relief. See, because
Right.
a compensation would it involves a calculation of on the basis of daily, and then it is it would be a higher amount than the 5 lakhs which the widows are today getting, which is why it's a monetary relief, because the government
Right.
is giving it.
Right. We'll leave it there for the time being, but thank you so much for joining us today, Dr. Pekam Basu.